history of providing neurosurgery services here in Fiji. So please welcome Dr. Parvinjan. And finally, I'd like to welcome Dr. Harinder Singh Sidhu, who's a medical doctor by qualification, who's transitioned into healthcare management, who also has an MBA from the prestigious Indian School of Business. He's currently Vice President, International Business Head for Apollo Hospitals Group. With his rich working experience, academic ability, customer orientation, as well as expertise in international resource integration, Dr. Sidhu has been spearheading the Apollo Hospitals Group's strategic marketing initiatives. He also leads international relations for the Apollo Hospitals Group. Please welcome Dr. Harinder. I'll just talk to you for a moment now about how we're going to run this session. Each of our panellists will speak for 7 to 10 minutes on their area of specialty and their area of particular interest in relation to this subject. And at the end of that, we want to have a conversation with people in the room. And we will welcome you bringing up other topics and asking questions. And we want this to be as interactive as possible. So please don't be shy. If you would like to speak, please just raise your hand and I'll indicate to you and put your microphone on and ask your question. Or it doesn't have to be a question. You can start a conversation. All right? So without further ado, I would like to start with Dr. Harinder, please.
Thank you, Moderator. Distinguished leaders, friends, colleagues, ladies and gentlemen, a very good afternoon. It's never an easy task to have a session and speak during the session after lunch. So I hope the session is interesting enough. We don't go into a nap. It's a great pleasure for me to be here today as a part of the Indian healthcare industry. To share and talk about collaborative models with the Pacific Island countries. I would like to thank the organizers for giving this opportunity. Why we believe India can be a very natural partner to the Pacific Island country, we have a few thoughts on the same. One, we share a common destiny. We are all developing countries. We have similar problems, similar challenges. Specifically in medical arena, we have the challenge of the rise of non-communicable diseases. It's something which we are grappling with in India, but fortunately we have been able to develop some solutions in India which are helping us now, which we are very keenly looking forward to share with our partner countries here. Like they say, there's no need to reinvent the wheel. So we have learned a few things, we have experiences, we have made a few mistakes which we don't want to be repeated. India, if I have to just share a few history in the medical field for the last 20-30 years, has done extremely well to develop the healthcare models for healthcare delivery. In 1980s and maybe early 90s, we were also a seeker of healthcare. A few Indians who could afford would go to the US or UK or any other European country to get the treatment done. And others were unfortunately left in India to get treated whatever was limited. I'm very proud and very glad to share that we have moved on from there, and now today India is a provider of healthcare to people all over the world. In fact, patients, a recent survey done by the Government of India indicated that patients from more than 120 countries actually come to India for their treatment. And we have had a few patients from Fiji and the other Pacific Islands also come to our hospitals or various other hospitals in India, and fortunately had very good experiences, good outcomes, and have come back very happily. Forums like these, we believe, are very important and critical so that we can talk about our experiences. And like in the morning, our Honorable Minister said that while we face the same challenges, but the solutions maybe have to customize and tweak according to the local needs. So these forums allow us to discuss those options, discuss those opportunities, and learnings for us as well, and something which we can take back home and use probably in our own country. With the stakeholders sitting here, with the leaders, opinion leaders, we believe all of us together have a joint responsibility to design and create healthcare models which are accessible, affordable, equitable, and more importantly, technologically very superior, which does not only justify the needs of the people of Fiji and the neighboring countries, but more importantly are sustainable in the long term. India has been working with the countries here. Personally, from our side, Apollo Group has been engaged for the last few years. My colleagues here have also been engaged, and there are others who have also contributed in development in certain areas. If I have to just highlight a few areas where we have experienced some of the benefits and the collaborations we have done, and also a few more which we can look at to benefit. Primarily, the first thing is what we have been able to help is to solve the immediate needs of a lot of patients. Unfortunately, currently the healthcare systems in this region are not as developed as we would like them to be, as the government would like them to be. And there are patients who need immediate care. You can't wait that, okay, in the long term we'll have a big hospital and we'll have treated there. So patients for cancer, patients for heart surgeries, patients for other ailments have been treated by Indian doctors. A lot of them have come to Indian hospitals and got their treatment done there. A lot of these patients have been actually operated here by specialists coming from India, two of them sitting here on the panel with us. So this is one area where India has been able to contribute in treating patients and actually saving lives. If you look at saving lives, it could be for young kids, for youth, even the elderly. If you save a life of a 40-year-old, you don't save a life, you save a family. You save a family, you save the time and the precious contributions he can make to the economy. So that's one area which we are very comfortable, and we have done it very nicely, we believe. Obviously, there are more we can look at. The other area is capacity building, where we can help in building long-term capacity for the healthcare professionals in the region. We as Apollo have trained a few doctors. Other hospitals in India have also contributed, and doctors from Fiji and other countries have spent time in India to gain experiences, to pick up protocols, to pick up systems and replicate them here. Our doctors, when they come here, they also work with the local doctors, nurses, and I'm sure they gain a lot during those experiences. And there are case discussions, consultations that happen. So there's a lot of transfer of knowledge and know-how which happens during these visits. The Government of India and Government of Fiji and other countries today morning signed a pact MOU for IT, setting up centers of excellence in information technology, which we believe is also very important as a platform to increase the reach of healthcare to remote areas. And it is very pertinent in the context of the Pacific Islands, where the countries have many islands and there are remote locations which are difficult to access otherwise, but the IT platforms can actually help you reach there. Things like the telemedicine network, where the doctors can consult and a person doesn't have to physically travel all the way to the mainland to get that access. There are other extensions of this platform like teleradiology, telepathology, EICUs is what the latest technology we are using in India to connect with remote locations within India, where the vital parameters of patients in the ICUs are monitored by intensivists at a central command center. So these are the few areas which have been very successfully, let's say, delivered by the Indian healthcare professionals and experts. And in the process, we have also learnt about the Fijian way of healthcare delivery and the other Pacific Islands, and seen areas and challenges and gaps which we are trying to see how we can contribute somehow to it. The other area is the expertise in actually managing hospitals. While there are health professionals to deliver healthcare in certain locations and hospitals, healthcare management itself is an expertise and a skill which we need to look at so that the systems and the processes in the hospital are efficiently run, the costs are controlled, the outcome to the patients is delivered as desired, the service levels are good. So that's another area of expertise where Indian hospitals have done extremely well, which can be something which can be brought to this country. We were discussing in the morning, and it has been brought up in other forums also earlier, is the expertise of Indian pharmaceutical sector. Unfortunately, we don't have anybody from the pharmaceutical manufacturing company, But the pharmaceutical sector in India has played a significant role in actually delivering good care at a very low cost. The medicines and the pharmaceuticals actually contribute a part of the whole treatment process. So that is the reason the costs in India are far lower than anywhere in the world. I'm sure some of you would be aware, just to give an example, a heart surgery, which in a developed world like US would cost anywhere from 100,000 to 120,000 US dollars, can actually be done in India at $4,000 to $5,000. So the differential is huge. That's what our industry has been able to bring for the people in India, and now we are looking at bringing it here. On the pharmaceutical side, I was told there's a huge need here of good pharmaceuticals. The Indian pharmaceutical contributes 20% of the global exports by volume in generic drugs. So that's the scale at which the contribution of the Indian pharmaceutical to the world has been. And we can look at how we can engage with the countries here and see how we can set up a supply chain network and a distribution network to ensure that the delivery of pharmaceuticals at the end point in the hospital or the pharmacy is always there. It's not an easy thing to do. It's a difficult location, difficult geography, but it's a doable thing, and we are very happy to share our experiences on that. There are other elements which we can talk about, and we can, I hope, during the discussions which will come up, and I'll be very happy to share anything more on that. But we are looking forward that these discussions which we are having today will actually come out with some outcomes and outputs which will be used, and we can actually contribute more in this field. Thank you very much.
Thank you, Dr. Harinder. What I might do is I'll hand straight over to Dr. Praveen Jan, and I'll do a big swing with the microphone.
Thank you, Welsh. Our respected dignitaries and all the delegates and my brothers and sisters who are looking at the video conference. As an Indian neurosurgeon, first and foremost thing, how I can add to the efforts of the Pacific Islands. First and foremost thing, we have to understand that our own conviction, what we believe, and as an Indian, first and foremost thing, I would say that we believe in Vasudhaiva Kutumbakam. We believe that everybody on the earth we all are brothers and sisters. We have to help each other in whatever way we can. In continuation with Dr. Harinder, whatever he has said, as an Indian neurosurgeon, I would say that we are the second largest population in the world. And as the neurological data says, that 3% of the population is expected to have neurological disorders. 10% of the population has around spinal disorders at some time in their life. And this makes a very big exposure to the Indian doctors who are dealing with all types of neurological disorders, and not only all types of, the number of cases which they are exposed to, they clinically examine, they diagnose, they treat, and which makes them a more skillful doctor. And it helps us in acquiring finer skills, and I would say that the treatment goes very well and the recovery becomes faster. The more we are exposed to the number of cases, our results become much better and better. And that is the reason all over the world, Indian doctors are considered to be skillful doctors. Right from the beginning of our training period, we have been exposed to all types of congenital disorders, spinal deformities, brain tumors, vascular aneurysms, then at the same time skull-based tumors. We have been doing not only the basic neurosurgical part, but we have been trained to advanced neurosurgical procedures, neurological procedures in dealing with like the endoscopic spine surgeries. Whatever comes in the world first, first thing we want to learn that. We want to take the expertise in it, and then we want to extend help to the other nations too. Along with it, the latest modalities whichever is available in the world, like interventional neurosurgical procedures, DSAs, intravascular procedures. All of things are being done, and we are very hungry to capture that expertise as early as possible in our tenure of learning. At the same time, I would say that because of the exposure, our experience increases every day. And one more thing, I would say that because as an Indian we are exposed, our culture is that we believe in charity also. And because of that, a lot of charitable institutes are there which provide the basic infrastructure and extend the medical treatment to the interior of the Indian continent. So that's how we have been taking the expertise, and that's how we want to extend to the Pacific Islands. I've been operating patients from the Pacific Island who travel to India, and I've given fantastically good results, and those patients were quite happy. I think that's all what I want to add. Thanks, Welsh.
Thank you very much. I'd next like to hand over to Dr. Chandra, who's going to talk to us about heart surgery.
Hello. Good afternoon, everybody. It is almost like I can say I'm at home at almost all of these Pacific nations, because during my tenure as a cardiac surgeon, I have had the privilege of operating on almost of patients from almost 5 of these 14 Pacific nations, namely Cook Islands, Fiji, Samoa, Nauru, as well as from Tonga. So I have, it is a very small experience which I would like to add. Being a cardiac surgeon, obviously we are at something called as a tertiary level of care. So we obviously depend upon the primary as well as the secondary level of care which is available in each of your respective countries. What we would like to add, like what Mr. Harinder as well as Dr. Jain said, that the tertiary level of care brings the Indian expertise as well as the confidence as well as the training from different countries of the world. Most of our Indian doctors do travel to Western, the so-called developed countries, the Western countries, get assimilated with the newer procedures, and then obviously there is an Indian touch to it, because there is a difference of pattern of disease seen in different countries. What I've seen in New Zealand, what I've seen in Australia, what I've seen in India, what I've seen in Fiji is very, very different. Even if though the patient may be of the same ancestry or he may be of the same race, but still there is an individual touch to every person. What we add definitely to each of these patients as well as to families is a quality of life. Most important is not the quantity of life, but the quality of life. I was talking to one of the doctors in Fiji who has said that in the last 20 years, the life expectancy in Fiji has increased from approximately 55 to almost close to 68 to 70 years. That's within the last 20 years, the life expectancy has improved from by a margin of around 15 years. Not only it adds to the non-communicable diseases towards the later end of the life, but also the person is alive to see all the chronic problems which he sees. Like as a cardiac surgeon, I understand the multifocal problem which might, blockages might develop in the heart of a patient. Maybe the diabetes must have set in at the age of around 40, 45, 50, but you start seeing the effects by the age of around 65 to 70. These patients obviously require tender, loving care, and most important, a good, well-structured approach so that we can conduct a so-called high-risk operation, even like a heart operation, in a reasonable way. To my say good fortune, I've had the around 7 to 8 visits to Fiji by now, and I've personally operated approximately 125 to 130 heart operations in this country with reasonable success rate. including the different diaspora of presentations, different challenges of medicine, as well as the logistic challenges, and explaining to the patients and the relatives, and making sure that all of them are addressed to in a very human way. Not only treating the patient, but also experiencing their problems and making them comfortable has to be our first line of approach, and only then they can allow us to operate on them. So what we strive as a Indian doctor, or as a doctor who has a requisite experience, is to help out to all of the countries where we can make a difference. Obviously, this will be sort of a give and take relationship. It won't. There will be a training of local doctors, local nurses. I myself must have shown a heart surgery to many new medical graduates who are coming out of Fiji, and all of them have been very, very enthusiastic to see a beating heart for the first time in life. So that's very essential. What you see on their faces is the excitement. What you see is the aspirations. We are here to make sure that those aspirations come right, and obviously in the process we try to make them enough that they can stand on their feet and sort of plant a tree of their own speciality, whichever they would like to approach, as well as to understand and choose in their way of medical field. So it's a very interesting experience on my part, and we would definitely be very happy to make sure that few more countries of this area take care of their own patients, as well as help us in coming right, and maybe we can make a difference altogether. As Dr. Jain said, that yes, it is very essential that we see the patients as brothers and sisters or a part of our family, and only then we can sort of instill that confidence, as well as that essence of trueness and the necessity of ethical practice. What as an Indian, I can definitely say that most of us do act by our heart and make sure that our brains are ruled by our heart. So we carry the same Indian spirit in our life, in our as well as in our surgery, and we are definitely more open to everybody to help us grow together. Thank you.
Thank you very much. Now to wrap up our panel presentations, and for those of you who came in after my introduction, I'd just like you to know that after all of our panellists have spoken, we're going to have a conversation around the room. You just need to raise your hand and turn on your microphone, and you can ask questions or you can start a discussion, whatever you like. So I'm going to invite Professor Manu to finish off for us. We've heard from Dr. Harinder about how India has basically turned around from becoming a country that used to seek high-end medical services from other developed countries to a country that now has 120 countries travelling to it to get its medical services. He spoke to us about what India can offer in the region, solving immediate healthcare needs, and I really loved what you said about when you save a life, you save a family. How true is that? He talked about capacity building, hospital management, and the pharmaceutical sector. Dr. Parvin Jan spoke to us specifically about neurosurgery. He introduced another really lovely thing that I'd like to quote, which is that we're all brothers and sisters and should help each other in any way that we can. I really like the messages that we're hearing from the panel here today. And he spoke to us about why Indian neurologists are very skillful, because they have such significant exposure. 3% of the population have neurological problems, 10% spinal. That's a big population. And he spoke to us about the number of charitable institutes in India who provide services in the interior. Dr. Chandra further developed that theme in relation to heart surgery, and he spoke about the fact that he's operated in 5 Pacific Island countries. He's had 7 or 8 visits to Fiji, and how they can bring expertise and training from their experience all over the world. This is something I've noticed with doing some recent recruiting from India. Many of the applicants have worked in 4 or 5 different countries. He talked about how in Fiji, for example, and it's probably the same in other Pacific Island nations, that our life expectancy has been increasing quite rapidly, and with that comes different challenges in terms of medical services. And he also reiterated the point about our Indian colleagues wanting to help wherever they can make a difference, and how much our young doctors here are benefiting from participating in the surgeries that are done by visiting Indian medical specialists. Professor Manu is recognised by the panel as being the most experienced and wise of them all. They were talking about that at lunch. And so I thought that we could finish with Professor Manu talking to us about the broad range of services, the things that haven't been touched on that he's aware of, and that he can, or things that have been touched on that he can flesh out a bit more for us. And then once he's finished, that's when we'll invite people from the floor to start having a conversation with the panellists. So, Professor Manu, over to you.
Good afternoon, everybody. Thanks for coming, all of you. The topics touched, I am of course not going to touch. Government of India and the health sector in India are keen to take medical services to all the Pacific countries, irrespective of the size of the country, its population, its complexity in transportation, and other strategic problems. There are a lot of challenges. There are a lot of problems about the natural calamities. We have to consider all these factors and look forward for capacity build-up. We are keen to develop the capacity in the respective field, in the respective disciplines which are necessary, or you can say the some level of tertiary care, where even the treatment is available somewhere in the overseas countries, but the patient cannot reach there. So what is required is at the doorsteps. Now, but at what cost? So we believe, under Narendra Modi's Prime Minister of India's policy, that the medical services must be made available, accessible, affordable, and accountable. So this is one of the most important 4 A's, plays a vital role in delivery of the medical services in the respective countries. Irrespective of the status of the country, whether it is a rich, developing, underdeveloped, small, medium, or big, there is a necessity of medical services at the doorsteps. Now, Sahyadri Specialty Pacific Hospital Limited, a Fiji-based company, of which I am a director, and we have the joint venture with Government of Fiji, Ministry of Health. There was an open global tender, various criteria were fixed, and we are providing for last 4.5 years the specialized services in cardiology, neurosurgery, advanced orthopedic, that is joint replacements, and arthroscopy. The major role was to train the doctors, nurses, paramedical staff in Fiji, as well as taking them to India, to our own group of hospitals, associated hospitals, and other hospitals for training. When I was coming with my team, now 2 members of my team, they are here. One is Dr. Chandrasekhar Kulkarni, who is operating open heart surgeries, and Praveen Jain, who is performing neurosurgeries. So we used to have a large number of team, more than 20-25 people. Now we are bringing hardly 8 to 10 people because local doctors, nurses are trained and they are capable of performing. Earlier for angiograms, Fiji used to send the patients to overseas. Today angiograms are performed here locally by the local doctors as they were trained in India by us in the respective hospitals, and the training became sufficient. We are also working for making available the pharmaceuticals at the reasonable rates, and shortage of medicines, which is a global problem, not only in the developing countries, but also in the developed countries. So we are working on that. The manufacturing sector in India, there are large international manufacturers are having base in India, and the price structure is also quite competitive in order to cater to the need. We are also working that how a Fiji can be made as a hub for medical services. It doesn't mean that the tertiary care cannot be made available in the smaller Pacific countries. We want that the smaller Pacific countries should also have the basic required tertiary care facility. I am not saying primary care, I am not saying secondary care, but even to certain extent the tertiary care facilities. So wherever possible, we want to look for a joint venture arrangement, partnership arrangement, or some kind of arrangement where the services can be provided at the doorsteps. Just for example, for a cancer patients, where a hub can be utilized for radiation and other treatments, where the smaller countries for a smaller population may be difficult considering various related factors. But there is a necessity of capacity built up, knowledge exchange, affordable medical services. At the same time, where the services are not available, they should be made available in India at a most competitive price. Now there are hurdles for the patients to travel to India. There are many other problems which are not related directly, but indirectly, like clearance from airlines and other related matters. We are working on that to streamline whatever way it can be addressed. And I am happy to tell you that many airlines are considering in a positive way to give boost for the needy patients, particularly from the South Pacific countries. I do not want to take more time, and I conclude here with that medical services must be brought to the doorsteps, must be made available, accessible, affordable, and accountable. Thank you very much.
Thank you very much, Professor Manu. So that's our first lot of presentations from our panel here. What I'd like to do is open up the floor to people around the room. And look, there's 2 seats on the other side where the microphones are. So if anybody would like to take a seat at the table, I invite you to do so. But also, if you're sitting behind the table and you can't access a microphone, just shout out your question, that's fine. So please just show your hand so I know who wants to speak, and turn your microphone on. Yes.
I'm just wondering, first of all, thank you very much. They're all interesting discussions, and it's exciting to see that, these are available now for the Pacific Island countries in some way or another. But another aspect maybe is, and I don't know what experience you have, is using ICT technologies to deliver some medical services to countries which you can't reach, or you can't reach in time when there is an emergency. And how successful is these kind of interventions?
Thank you very much, sir, for bringing this important topic. Very briefly, I had mentioned in my earlier thing the use of information technology in healthcare services. It can be used very well, and it actually increases access for people in remote areas. Just to share the Indian experience, we are also a large land. We don't have the problem of remote islands, but even in India, the population is distributed heavily in the remote areas, in the villages. So we have successfully used the telemedicine network. As Apollo, if I can share, we have 109 telemedicine centers which operate within India and outside, where we have regular consultations with specialists for patients who need any care. Within our network also, we have actually used telemedicine to operate on patients, where a highly specialized surgery who may not be able to travel to the remote can guide the surgeons there during a live surgery. Apollo Hospitals also has a collaboration with Government of India, which has something called as a community service center in villages. So there are kiosks in villages, 60,000 of them actually, which are used by the local villages for other services. And about 2 years ago, we collaborated to use that platform of IT to actually start services for healthcare as well. So that's one part of the services on primary care and consultations. It has got extended now to diagnostics as well, where teleradiology is a service, which as I know has also been offered in Fiji, because having a senior radiologist is a challenge sometimes, and you can't wait for weeks in some cases or days for get a report for your CT scan or an MRI. So experts sitting on the other side using the same platform can actually see the reports and report back. It can actually be done live, but given the time differences and zones, it can be reported back within 18 to 24 hours. Extension of the network for other diagnostics is the telepathology, where the slides are actually viewed by specialists again in India. And coming to what you mentioned in cases of emergencies and other critical ailments, we do have a platform with some of the big equipment companies which we are using in India. In fact, within our own network as well, we as Apollo Hospitals have 66 hospitals in India. But not all 66 will have the super specialist or like an intensivist all the time, 24/7. So we use it as a platform called eICU, electronic ICU, where in a remote location you have the technology, and there's a command center at the hub, which actually you can see the parameters live of the patients who are there, and they are monitored, and any intervention required is directed from there. Similar model has been extended to manage a 24/7 emergency network also. I'm just giving an example here. In case, let's say, in the middle of the night, there's a patient who comes with trauma and goes to an emergency here, and maybe the specialist to handle that is not available. So this connectivity live with the center in India. In India, most of the hospitals are actually working 24/7. Emergency services are provided at the same level of care. A consultation with India to discuss the case, to see what has happened, can actually help in making sure that the patient gets the best treatment. Similarly, let's say in case of cardiac, if somebody comes with a cardiac heart attack, what's commonly called the myocardial infarction, they can be discussed on seeing, okay, making the right diagnosis first. Is it a heart attack, or is it some other chest pain, or is it a epigastric pain? So these are the models which all will be delivered having a good IT platform, the ICT, what you mentioned. We have used some of it within India. We are extending it to other geographies. In fact, our Honorable Prime Minister has launched a network with some of the countries in the region there, with the CIS countries. The Government of India has a platform called Pan-Africa E-Network, which is in 43 countries in Africa, where education and other services are provided, and Apollo is a backup partner for the healthcare services. I'm aware of such discussion happening between Government of India and the countries in the Pacific Island. In fact, there have been advanced discussion, if I may say, but In some of the islands, there's still the need of getting the IT to a certain level, the internet bandwidth and issues like that. I'm pretty sure this will happen very soon. So there's a huge role which the IT can play. I think Dr. Jain wants to add as well.
See, additionally, there's a basic need of educating the local doctors who can receive this telecommunication system and implement it. So the basic facilities ought to be there to implement whatever is advanced techniques are transmitted through the electronic media or by any other means. So that basic capacity development, basic infrastructure, I can say, that is a need. And once that is done, then of course, things will be easy to take forward. And we are here definitely to contribute in the best possible way to develop that basic capacity requirement. Thanks.
To add to it, what Professor said, actually I wanted to say the same, and I would say rather add that all these things we are saying with a conviction and confidence because we have been doing this day in and day out in India. That's the most important part. Many of the remote places, doctors who are not approachable, they come and spend some time with us, and after that they communicate with us. They look at the patient and then communicate, and we ask them the questions, see for this sign, see for this sign, and they spend very less time with us, but within that span they get a decoction of the basic primary things which are to be seen in neurological patient or cardiological patient. So this is what we have been doing it. So this can be easily extended. Thank you.
Thank you. That was a great conversation you opened there. I learned a lot. And could I ask anyone else who wants to start a discussion or ask a question, please tell us your name and where you're from. Thank you.
Thank you, Madam Chair. My name is Samuel from Nauru. First, I would like to thank all the presenters for their very informative presentation. And of course, Nauru is very happy with your ongoing assistance towards our patients that we've been sending to your country. I think my comment or question I would say is that how do you consider, or do you, talking about another aspect, which is in our country we call it witch doctor, but not really witch doctor, but local medicine. Local medicine in terms of herbs that cure patient with the same patient that might have that tablet at the same time get, So do you encourage local medicine and also like local treatment in terms of like if there's in back home when the accident, head injury, we use the banana root to look. But in modern technology, you do the CT scan and all those can. Even for fractured, you put a plaster. But for local, they use the massage. They said more effective. I don't know. I'm just saying that how do you treat the local traditional knowledge of medical? Do you encourage that, or you just, that's my question. Thank you.
Very interesting question you have asked. I would say that first and foremost thing, we have to understand what nature has given us. And we should never forget that all our ancestors have been living with all those facilities which are available in nature. All the medicines which are being provided or they are manufactured, they are based on those medicinal plants. But because it is an era of science, we have to understand that science asks for documentation and the facilities which are available. This diagnosis has to be there and you can manage. But at the same time, you can take the help of a local doctors who are providing those medicines and the role of it. The same medicine which allopathy gives, the same component may be derived from that plant, which the local plant is giving. Then it is almost the same. But we have to diagnose it properly and then do it. We cannot treat a head injury patient without doing a scan. If the patient is conscious, fully oriented, yes, we can do the local treatment because of the local swelling. This can go. But having a scan and then doing it under the instructions or the guidance of the specialist, it makes a world of a difference. We are going ahead with the basic Ayurveda in India also. We are modifying our own lifestyles based on the medicinal plants which are available in India, like cinnamon and all those things which are available. We are modifying our own life with those plants itself. Many of the, I would say that elite class of India now has started believing in Ayurveda more than allopathy. Thank you.
Can I just add to it? It is like a simple thing, like what you said for applying a banana leaf for a head injury. The same thing, there was a very good thing about burns. When you have a burn injury, many people use potato peel skin in addition to the medications which we are using. So everything needs to be going hand in hand. It's not like we are fighting against each other. Both of us, if we are doing something good for the patient, might as well contribute 1% from each so that we complete the 100% of treatment of a patient. Thank you.
My other comment is it's to do with sustainability, because affordability, as my friend said, the 4As, because they afford plants rather than the processed. Well, that's my question.
Thank you for the presentations. Now, my name is Hakawa from Papua New Guinea. Whilst listening to the presentations, and I guess to me, a lot of it is probably mostly focusing on the curative approach to health, right? Now, when we talk about the 4As, one of them is affordability, right? And for my country, we put a lot of our financial resources into the health sector. It takes up about the second largest of our budget. And that sector is, like I said, it's the largest expenditure sector for us. Whilst we take the approach to sustainable development, we talk about how best can we be able to look at that sector and reduce the cost of healthcare or health services. So that is a greater challenge to us. So I turn it around to say, when we talk about curative, can we also look at the entire system of the health system, and we talk about prevention so that we do not put a lot of resources into curative approaches, but make sure that we are responsible right from the beginning, so that we reduce the cost of our health and it's affordable to a lot of us. I think for my country, we have a very big medical concern, especially in the area of non-communicable diseases, especially lifestyle, that is contributing to a lot of the diseases that we have in country right now. But like I said, we're taking an approach for sustainable development, and we're taking an approach where we'd like to see that the entire system is such that we can be able to provide access to medical services, but at the same time affordable medical services. And so the curative preventative measure is something that is strong with us.
I might ask Professor Manu to start off with a response to that. Professor, I'm really glad that you raised that, because NCDs are a very big problem throughout the Pacific, and we're all grappling with how we can change behaviour and get our citizens practising preventative approaches so that we don't have those costs at the end. So Professor Manu, and then maybe Dr. Harinder would like to speak after that.
Thank you very much. I think most of the things I have discussed with you. If you have any specific question or any specific thing you want to know it, or any elaboration or any gaps, ifs and buts. So I would like first to get from you.
So we had a question about preventative approaches with NCDs and that sort of thing.
Yeah, regarding the NCDs, is a global problem. Is also related to climate change. So there is all interrelated things. We want to address those based on individual countries' need. There are some common platform where common solutions are there. There are individual solutions to be developed and to be operated. Now there are many ways of tackling those issues. India is looking forward for extending the help where the natural calamities, the sea level, the various other climatic conditions are affecting the livelihood. So there are various solutions. There are lifestyle changes required. There are food style. There are a number of other elements like exercises and other things which plays a vital role, and we are lacking in that for one reason or other. We want to address those issues. There are many issues which cannot have the medical solutions for that, or directly you cannot have this is a climate change situation, so this is a solution. We all have to work together to come to the solution and to adopt the change of scenario in the right spirit to come forward. Thanks.
Thank you. Thank you, Secretary. I think what you brought out is something really important for all countries. Like they say, $1 spent on prevention will save you $100 in curative services. Yes, we are also grappling with the same NCD challenge in India. The balance between the communicable disease and the non-communicable disease has changed over the last few years. There are a lot of initiatives taken in the Indian healthcare industry, primarily driven by the government of India. It's taken more as a public policy and public health issue. The private sector does contribute its bit, but the larger portion of it is managed by the government of India. Just an example of the burden in India, there are reports which say about 40 million people in India suffer from diabetes, which is, I would say, more than the population of the entire Pacific Island countries we are discussing today. So it's a huge burden in India, and one of the senior leaders in India at a forum said, well, it's probably the largest number, this is one gold medal we don't want. So this is something, similarly we have a huge incidence of hypertension and other lifestyle diseases. The government of India has a national prevention control program for diabetes, where they're actually looking at how everybody is screened to make sure that you catch them early. So apart from educating and creating awareness to follow healthy lifestyles, exercise regularly, your diet patterns, which have continued the way it used to be 20 years back, whereas the lifestyle has moved from a more active lifestyle to a sedentary lifestyle, which has led to all these issues. The other thing which the government and the private sector actually plays a big role is making sure that we can diagnose early. One is prevention of the disease, but very important part is an early diagnosis program. What we do in this area is actually encourage people to get a regular health checkup done. Just since we're talking diabetes, it is also called a silent killer. You would actually not know of diabetes unless one of your body organs actually develops a critical ailment and symptom, which then makes you run to the doctor. So we do a lot of preventive health checks, monitoring the basic parameters for your cholesterol, your lipid profile, your renal, liver and other functions. In Apollo alone, we actually do about 300 health checks in a day. across a network. So patients who want to come, and they're very, very affordable, as we can do it actually a complete profile of your body for about $80 to $100 US, where all your parameters are checked, including some basic x-rays done. Women are encouraged to undergo mammogram after a certain age. The other required tests which are required, you do an ECG, echo, whatever is in case of, depending on the age group for which you're trying to screen. So that helps you to catch the disease early and manage it much better, rather than treating it later on. So there are a lot of efforts in this space. Well, like I said, somewhat driven by the public sector in terms of policy and national programs, somewhat driven by the private sector in the same space. I hope I've been able to respond. Thank you.
To add to it, even we have national programs which the government also runs for the check, and that helps to reach to the remote places where the patients, they are not able to come. That also is one of the advantage, where when the country decides, then they can reach much better. And at the same time, one more thing which I don't know whether I should speak on this platform or not, about some of the diseases which I myself believe are specifically present in some areas. And if you look at the nature, if you look and if you study the lifestyle of the patients over there, you will certainly find some difference which is not there in the other areas. That makes me think that there is some change over there. Second thing, the treatment is there in those plants available in that area only, that island only. I'm just giving you an example. I belong to a very remote place in Rajasthan in India, where this malaria is common, falciparum malaria. And you will not believe that there are plants, you take one leaf a day and you will never have falciparum. So that's the thing. So I would say that probably we are seeing the patients because we are doctors and we are seeing those patients. There are so many things. We are into the health programs and we look at it. But we are not looking at the other aspects of the surroundings. That is what, I don't know whether I should be mentioning it, but this is what my observation is. Thank you.
If I can add a bit more, sorry for that, but like when for my particular cardiac disease, since I think NCDs, cardiac disease have a very, very major part of the thing. Obviously diabetes and hypertension are related to that. It's like when I see a patient who's say age 60 and I operate him for a bypass, I make sure that if he's a smoker, make sure I talk to all his family, like his sons or his any other close friends, that make sure you stop smoking, make sure you take your medications, make sure you take your tests at least 10 years before your father had your surgery. Like say if your father has had it at 55, 60, make sure you check yourself at around 45. Because the lifestyle which the father and the son are going to have are approximately the same if you are native to that country. If he's sort of migrating to another country, there might be a secondary change in his lifestyle. But if he's in the same country, there is a good chance that the father and son or the mother and daughter or anybody in the family will have a similar lifestyle. So when you are intervening as a tertiary prevention for my patient, I make sure that I also advise primary prevention for the family. So this is how we would like to start. And what Dr. Jain said that yes, there are lots of government programs to drive. For example, when I'm considering small kids with heart disease who come for surgeries with either say holes in the heart and all those things, there is a very well established government program in many states of my country where most of the operations are done free, especially for at least 50 to 75% of the population. If they belong to a particular income level, they are absolutely done free. So they don't even have to reach they get the same treatment even in a very good hospital, but obviously the government is a provider. Say for example, if you see a cigarette packet being sold in India, the 80% of the entire cigarette packet is marked as injurious to health. The rest, only 20%, is for branding. So that sort of impact goes to every person who smokes a cigarette. But still, he smokes, that's fine, but he pays for it. But at least the government makes sure that 80% of the space of there is no advertising. It's only a lung cancer photo of the patient onto it, which creates at least some sort of a idea or a imprint in his, maybe in his son or his daughter, that yes, this is something wrong. And obviously, what you start from your kids, you start at school. So there is going to be a age, there is going to be a period in each one of the nation's life cycle where you will be spending more on tertiary, but at the same time, you might have to invest a bit more in primary, and obviously allow the tree to grow. It takes a bit more time. Yeah.
I'm very pleased to tell you that we have another 15 minutes because the conversation is interesting, and one of my fellow panellists said that the discussion that's coming up from the floor is so interesting that every panel member wants to talk about it. So thank you very much for that. I'd like to invite others to make a comment or ask a question.
Thank you, Madam Chair. I am Harpreet from the Fiji Police. I have not totally related to health, but we have a welfare scheme in-house at the police, and Dr. Setu here would agree with me. We usually send our officers to Apollo for operations, evacuate them for certain ailments they might have that require. I'm particularly interested in this session because I'm a direct beneficiary of Indian Health Service. The Satya Sai Sanjeevani Hospital last year operated on my 2-year-old son. He had that open heart surgery, and he was treated for ASD. He had a hole in the heart. So I owe a lot to the Indian government and the people for being so generous, because they performed the surgery free of charge. And after 3 weeks of his operation, I was supposed to go to Delhi for a 3-month course, and I told my family, no, I'm not going because I have to look after my child. And they said, no, you go. My wife is a nurse at the CWM hospital, Paru, and she said, okay, I'll stay home for 2 months and I'll look after him. So I had the opportunity of going abroad to India again. It's again a ITEC, under ITEC, the Indian Corporation, Economic Corporation, they provided this scholarship. So it was again a big beneficiary again of the Indian government that, and then I saw this presentation by the Barefoot. That is also a very big boon by the Indian government on the rest of the world. So I also wish to thank each of you here present today. It's my heartfelt thank from myself and my family for the great work that you're doing. And I pray, and we pray that you continue doing so. Thank you.
I hope your son is doing well now. Very good. Now, just since you brought this up of Fiji Police, and I'm connecting to the earlier question of preventive medicine, just to share on this example what we have done when we work with some of the communities here, and one of the institutes is Fiji Police. So while he mentioned about the patients who have come to us for treatment, I don't know if you recall, about 2 years ago, we actually did a program here in Fiji on awareness at the National Police Academy, where doctors delivered lectures on preventive lifestyle. We had a cardiologist who actually delivered how to maintain your heart health, how to have an active lifestyle. We had a gynecologist who actually spoke to the staff and females in the Fiji Police to actually taught them self-examination of the breast to find out a lump early in case of breast cancer, and educated about the pap smear because we believe the breast and the cervical cancer are the largest challenge here in this region. So we do work in those sites to make sure that there is a lot of education done and prevention taken up. And also I've just been informed that your police commissioner here has taken up very seriously health profiling of all the staff. He, I believe himself, is a fitness freak, and he's made sure that every staff in the Fiji police undergoes a health checkup and there's a health status report which he wants. That's a good initiative, I would say.
Yes, for the information of Madam Chair, you would be aware that Minister of Health, in conjunction with the Fiji Police Clinical Health, is doing a health audit. Just yesterday I had to go and have that done as well. It's a very compulsory program, like Dr. Sito has mentioned. So many doctors have come to do presentations with our senior officers, and they've shown very terrifying pictures as well of what the NCDs and all those things can do to human health, and especially for the disciplined forces where men and women have to be on their toes and physically fit. They really have to look after their health as well. So, yes.
When we come to Fiji, we want the Fiji police to be fit and healthy. We feel safe. We don't want you in India. Be fit and safe here. We don't want you to end up in India for anything.
And Dr. Chandrasekhar had mentioned something about the 80% of the cigarette packets in India is supposed to be. I've also seen that, and I've also seen a lot of them eating
tobacco.
Yes, tobacco as well. So that is a very big concern as well. Yeah. Thank you.
I'm happy actually what you said. Recently we have conducted the free screening for armed forces as well as for the general public in Fiji. We also in the recent meet of WHO, we offered to all the Pacific nations that we can conduct free screening in their respective country. In Fiji, for last 4 years, we are conducting free screening in different locations, and Government of India is also providing with a cultural troupe where we are doing cultural troupe, that is cultural program or cultural event for medical awareness, and at the same time the screening is made. Our doctors speak during the cultural program about the awareness, and today, say when we started about 4 to 5 years back, that time we had so many patients that where we had to request his department to come and control the patients. Today now the awareness has increased. Local doctors are also trained, so the graph started coming down. So I am thankful to him for extending his support, because the Fiji police and armed forces, they all fall under the one ministry. Thanks.
Hello, Manfred Depone, Nauru NGO. Thank you, panel, for your presentation. Thank you very much. I wish to ask you about the new medical techniques, especially in stem cells. Can you update us on that, please?
Stem cell studies are still going on, but I would say that nothing has still been concluded very clearly. So all these studies are still, they are being done in US also, they are still being done in India also, especially for the spinal cord injuries, where the patients, they have grade 0 power after the spinal cord injuries. They have been tried for Parkinsonism, they have been tried for various neurological disorders, congenital disorders, but still nothing concrete has come. But still people claim, even the Western world claims, but we still don't accept unless and until we get authentic reports. Thank you.
Good afternoon. I'm Fiame from Samoa. I wanted to ask the panel around the general issue of sexual health, the challenges that you experience. I speak specifically to the rise of rates of chlamydia here in the Pacific, very high rates. And although the data is there, we're not seeing the policy responses coming back. And I don't know whether this partly has to do with a prioritizing of what is important medically. I don't know whether it's a gender issue. I don't know whether it's a societal issue that you don't talk about sexual stuff. So I just wanted to raise this because I think it's an indicator that's quite serious. And it's probably an indicator that might also speak to AIDS, to which the Pacific generally says is doing all right. But it could be a masking of a problem that's there.
This is a very important issue, especially when the children are growing. I would say that we as parents individually have to communicate with them. There should be classes of sexual education in the school itself when they are in the teenage. This is all is being done in India. Third thing, at the society level, both males and females, they have to be explained the pros and cons, all the things, what all transmitted diseases are there, what all precautions can be taken, and how it can be harmful for the children. So that's a that I would say that can be culminated significantly by awareness programs and the education. And it has to be on the large scale at the national level, so that it goes to the school, it is in the curriculum of the school as soon as the child is crossing the teenage, and beyond after the school also the parents have to communicate, even the teachers in college can communicate. This is the best way to curb it. Thank you.
I understand that that is the best way to go. My concern is I'm not seeing the policy responses around our region. Is your experience in India different, or have you responded to a challenge, if you do see it as a challenge?
You mean to say that the policy it's at the national level. In fact, I would say that when I was a child, when I was in school, we had a class of sexual education, and it is almost 30 years back I am talking of. So obviously when I was taught, then when I used to come home, the parents used to talk that now you are growing, and now I am talking to my own son. So it has to be, initially you will find challenges, but it will take some time. And especially in the remote places, sometimes males are more aggressive, but you can communicate with the females. They will understand the gravity better, and then it will help. Because they may not open up initially because they are shy type of people, but they will.
Sorry if I could intervene on this question. Excellency, you're absolutely right. This is not an easy thing to do. Not only in India, not only in Pacific Islands, everywhere society has resisted in discussing this topic so openly. It's a gradual process. I think we have made a beginning. If you ask me, when I was a teenager, nobody really talked to me about sexual education. Things have changed post-HIV epidemic, when really it was hitting us in our face, and gradually we thought it's a good idea to talk about this aspect rather than letting those kids fall trap to this problem. I'm sure with passage of time this will grow. More and more people will accept that this is a good idea to discuss. But even in India, today in India, there is a rural and urban situation. For example, in big cities, yes, schools are discussing this issue, but in rural India, they are not yet. So I think this is a long drawn process. It is not going to happen overnight because there are cultural inhibitions to discuss these issues. And I keep my fingers crossed that sooner we learn, better for us. But I don't think we have won this war.
I'd like to add something there as well. I agree with you about what happened with AIDS, because after that there seemed to be a global push to get people to use condoms. And that's made a huge difference in the spread of STDs. But they say that that's starting to change again, especially with older women, for example, who are becoming single for the first time in decades, and they're not, they weren't brought up, educated to use condoms, and they're starting to take risks. And I think it's an ongoing education. But that has been one of the key drivers in bringing down the incidence of STDs across the world, is just a simple thing like the use of condoms.
A small issue. In fact, we have really succeeded in educating the sex workers. I think that is a very major achievement, because they were really source of transmission of this problem, especially on the highway routes, where somebody was traveling from north to south, 3,600 kilometers, and this was an open issue for carrying that problem with him. So there we have succeeded a lot, because there was much lesser inhibition discussing that issue with them, and on their part also it was much, their resistance was much lower. So I think there we have succeeded a lot, but coming to the ordinary society, there is still a great deal of resistance.
Well, we've reached the end of our panel discussion time. I can allow one more question if there is a burning question. Otherwise, I might. Sorry.
Can I? Yeah.
Yes. You may.
I mean, I don't mean to be cynical. I'm Joe from Fiji, but I wanted to ask about the cost of healthcare. If you could explain to us the difference between private healthcare and public healthcare in India, and who can afford what? Because here in the Pacific, private healthcare can only be afforded by those that are working and are in some kind of medical insurance scheme. And because we have our economies are not that robust, the conditions of our public health care is in a poor state. So I'm also wondering if your outreach to the Pacific is going to sort of address that healthcare can be affordable for all.
So you said you want to know the cost, is it the absolute cost in India, or the difference between the public and the private sector in India?
Well, yeah, just generally. I mean, you've mentioned that you're much cheaper than the United States,
Yes.
but in the Pacific, we are very different from your economy.
See, the cost, like I shared an example, we are far cheaper than the developed world, or even in some of the other countries close to this region, let's say Singapore, Thailand, and other places which have those services. We would be 1/5 or 1/10 in some of the cases. I shared an example earlier about a heart surgery. Let's talk about a joint replacement, which would be $20,000-$25,000 in these countries. We do it $5,000-$6,000. So there's a huge difference in cost. And when I'm talking about these costs, these are the private sector costs. The public sector cost in India is further less than this. It's obviously lower because the public sector gets funds from the government to run their institutes, whereas the private sector, we have to generate funds for our technology and our recover our costs. So in that sense, yes, the private sector is slightly higher than the public sector, but overall the costs are far lower. In general, if I have to say why the costs in India are lower, is one, biggest factor is the volumes in India. Because we have huge volumes, so the economies of scale kick in, which helps us keep our input costs low. We don't have to buy drugs from outside, we manufacture ourselves because it is justified for the manufacturers to produce in India. The equipments are manufactured in India. We use our resources very efficiently. If we have, let's say, example, a high-cost CT scan machine, we will use it for, let's say, a larger number of patients, so the cost per patient is lower to recover those costs. The pharmaceutical industry has helped us keep the cost low. Even the manpower or the human resource is not very high. So all these factors help us keep the cost control. The other thing you mentioned about the insurance, yes, while we're talking about low costs, we have to still make sure that there's a financial access to good health care. There are private insurance companies in India, which is growing very fast. Then there's a public insurance model, where the government in various states, in various provinces in India has actually come up with very innovative schemes, where you have to contribute as little as, let's say, 1 cent a day, or sometimes it's sponsored fully by the government, and they've used an insurance model to pay for the treatment at the best hospitals by the government for patients who can't afford treatment on their own. Like something like what I'm aware of, Fiji, there's a free medicine policy for patients earning below a certain level. So similarly, very innovative insurance models have come up in India, and I'm sure some of them can be replicated here. National health insurance plan, because majority the services here are provided by the government. It's just creating a model so that you diversify your risk. Insurance is a diversification of financial risk. So if you can look at those models, I'm sure it will help in creating more access to finance for healthcare.
There are certain things when you come to the cost analysis for a particular medical procedure. Say India is today said to be the lowest in the world. Said to be the lowest. There are some other countries coming forward. Obviously, the question comes into the mind that in US the cost is $150,000, and if it in India it is $10,000, then what is there? Whether there is any compromise on some fronts, whether the quality is going to be good, a number of factors come to the mind. So in the beginning when we came here, so that time many Fijians used to ask me that this vast price difference between Australia and India, does it mean that the treatment in India is of an inferior quality? No, that's not the case. See what happens, now say the Dr. Kulkarni, who is performing the open heart surgeries here. Now when he was also practicing in Auckland Hospital. Now when he was performing the surgery in Auckland Hospital, the Auckland Hospital charges were say maybe $80,000 for an open heart surgery. When he comes to India and the same surgeon operates in India in the Indian hospital, the cost is said to be $10,000. So the same doctor, medicines are going to be the same. It is just like, sometimes I don't want to exactly make the comparison, but many times it happens that Fiji water we are going to Holiday Inn for buying it, rather than buying it in MCH. Now, as far as the quality is concerned, Indian pharmaceutical industry is the leading player today globally. Now, WHO policies, other governmental policies are, I do not want to go more deep or make any comments on that, but coming back to the cost analysis in India, the best available treatment with the lower cost due to number of factors, the availability of number of hospitals, government contribution, government controls, not only on the surgery part or the hospital part, but also manufacturing, pharmaceuticals, labor, and number of other areas. So taking the combination of all, the cost is low. Now, in Fiji, when we work for coming out to the cost analysis, we wanted to work out the cost at which the operations are performed in India. We should be able to perform almost on the similar price over here. Now, making the cost analysis, just broadly speaking, you just cannot go that in India it is made for $10,000, but you have to consider to and fro expenses, the stay and other things. If you combine all those, today there are many countries saying that the Fiji is a coming destination for medical tourism. And I'm happy to tell you that some of the patients from Australia are referred here for the surgeries, and they were being performed. Thanks.
Thank you, Professor Manu. And on that note, I'm going to have to wrap things up. It's been a fantastic discussion, and I feel very privileged to have been asked to be the stand-in moderator for the Minister for Health. I'd like to ask you to all please thank our panel members, Professor Manu, Dr. Pravinjan, Dr. Harinder, and Dr. Chandra. I have a couple of quick announcements to make. Please be back at 3:45 for the next session on blue economy, which is here. That means you've got 5 minutes for afternoon tea, sorry. And please visit the exhibition pavilion just outside this room. Thank you. Thank you so much. No problem.
Thank you very much. It was a privilege.
Yes, it was my pleasure. Thank you. That was really interesting. Thank you, Professor. That was great. Thank you very much.